Hi, I am Kaylee Summer, and this is my pro-con speech. Did you know that airlines spent over $275 million on 350 million additional gallons on fuel in 2000 to compensate for the additional weight of passengers? Obesity is becoming a serious problem in the United States. Dr. William Dietz confirmed that there's an estimated 66% of American adults that are overweight, meaning 1 out of 3 American adults is obese. The number of estimated children that are overweight has over tripled in the past 20 years. There has been much controversy over this epidemic by professionals questioning whether obesity should be classified as a disease or not. Obesity is defined as a body mass index of 30 or greater by the Webster Dictionary. Body mass index, or BMI, is calculated by taking a person's weight divided by the square of his or her height. In order to characterize obesity as a disease, it needs to meet the requirements of a disease, which are the following. 1. Impairment of normal functioning of some aspect of the body. 2. Characteristic signs or symptoms. And 3. Resultant harm or morbidity to the entity affected. For professionals of the American Medical Association arguing it is a disease, claim that it meets all the requirements of a disease. 1. Does it lead to impairment or normal functionality? Most doctors and professionals say yes, it does. Studies have shown obesity alters normal endocrinological and physiological states, and also modifies function of cardiac and musculoskeletal systems, which leads to dysfunction and degeneration in the heart and joints. Does obesity have signs or symptoms? There are no specific signs or symptoms, but there's just a sign of greater weight. And lastly, does obesity result in harm? Studies have shown that in 2004, over 111,909 deaths were associated with obesity, which was much higher than they expected. The World Health Organization called obesity a chronic disease in its 2000 report, Obesity: Preventing and Managing the Global Epidemic. Proponents stress that declaring obesity is a disease would remove the social stigma associated with obesity, afford it the same legal protections as other illnesses, and force medical professionals, insurers, and employees to treat it with the same degree of concern given to other diseases. Professionals arguing against obesity considering a disease say that it does not meet all the requirements and it is a lack of personal responsibility. Does obesity lead to impairment in normal functioning? Professionals of American Medical Association argue that obesity is histologically defined as an overproduction of adipocytes, which leads us to another question. Does overproduction qualify as an impairment? The professionals say no, because body fat storing is a useful adaptation in a setting of food deprivation. Requirement number 2, does obesity have signs or symptoms? There are no specific symptoms of obesity, there are only non-specific signs, leading it to not really qualify as a disease. And does it harm? Is it a direct link between obesity and morbidity? Doctors of this end say that obesity does not cause harm by itself, only through an increase in the risk factor. So it does not specifically qualify as causing harm and is not qualified as a disease. These doctors argue that it is a matter of personal responsibility. People become obese because they make bad dietary decisions and do not exercise enough or even at all. Opponents argue that classifying obesity as a disease would scare overweight or obese people who are healthy into seeking unnecessary medical conditions, divert public funds to treat a preventable condition, and be discriminatory towards people who choose a different body type. They say that categorizing obesity as a disease would not address the underlying problems causing it, such as poverty, the prevalence of unhealthy processed foods, lack of public policies encouraging exercise, and other environmental factors. With a lack of clear consensus among government entities and medical associations on whether or not obesity is a disease or not, advocate groups continue to lobby for and against classifying obesity as a disease. Many doctors of medical Association and professionals of Centers for Disease Control and Prevention have proved in ways obesity can be called a disease and it meets all the criteria of a disease. They stress that declaring obesity is a disease would remove the social stigma associated with obesity, afford it the same legal protections as other illnesses, and force medical professionals, insurers, and employers to treat it with the same degree of concern given as to other diseases. Other doctors of the American Medical Association and experts say it is not a disease and does not meet all the criteria. It is simply a lack of personal responsibility. Whether or not classified as a disease, it remains a serious public health issue in the United States. In order to help solve this epidemic, intervention by physicians is necessary, and environmental and policy changes are also equally important for this promotion of obesity prevention. Thank you.